Diabetes is the seventh leading cause of death in the United States. Someone with diabetes does not process food properly for use of energy. The pancreas normally is in charge of releasing a hormone called insulin, which carries glucose to our cells. With diabetes, the body doesn't make enough insulin. This causes a buildup of sugar in the blood, which can affect blood flow. There are two types of diabetes. Type 1 is often hereditary. The immune system attacks insulin-producing pancreatic cells. Cells are destroyed, which then reduces body's ability to produce sufficient insulin to regulate blood glucose levels. Type 2 diabetes is more common. This type develops from excess weight, lack of exercise, or unhealthy diet. Cells become resistant to insulin, body stops producing enough insulin, then body cannot use glucose effectively. In this diagram, you can see how diabetes happens in the body. The stomach changes food into glucose. Glucose then enters the bloodstream. The pancreas makes little or no insulin. Little or no insulin enters the bloodstream. Glucose then built up in the bloodstream. Diabetes can cause health complications such as heart diseases, blindness, kidney failure, and amputations. It is very important to know if you have diabetes to get it treated immediately to prevent complications. Diabetes can be hereditary, so it is recommended to someone with a family history of diabetes to get tested. In this chart, you can see the blood sugar levels for a normal, pre-diabetic, and diabetic person. A fasting blood sugar for a normal person runs between 80 to 100. Right after eating, 170 to 200. 3 hours after eating, between 120 and 140. A pre-diabetic person with a fasting blood sugar runs between 101 to 125. Right after eating, 190 to 230. And 3 hours after eating, 140 to 160. A diabetic person has a fasting blood sugar of 126 and above. Right after eating, 220 to 300. And 3 hours after eating, over 200. 5 signs and symptoms. Frequent urination, excessive thirst, sudden vision changes, sores that are slow to heal, and tingling or numbness in the hands and feet. 5 root causes. Heredity, obesity, poor diet, hormone imbalance, or autoimmune reaction. 5 lifestyle recommendations. Eat healthy, exercise, regular doctor checkups, manage stress. Higher stress equals higher sugar levels. Stop smoking. Chances of getting heart disease increases, plus makes exercising harder. 5 home remedies. Flax seeds. 1 tablespoon of ground flax seeds in a glass of warm water helps in absorption of fats and sugars and lowers sugar. Green tea helps body use insulin better. Bitter gourd or bitter melon. Remove seeds of 2 to 3 gourds. Use a juicer, extract the juice, and add water. Drink daily in the morning. Cinnamon lowers fasting blood sugar. And ginseng improves blood sugar control. 5 mainstream tests and treatments. Blood glucose test. This test is measured in the blood when fasting. A1C test. This test is also measured in the blood, fasting, and it detects the average of the blood sugar in the last 3 months. Random plasma glucose test, or RPG. This test is done non-fasting and can be done in the clinic at your doctor's visit. Oral glucose tolerance test, or OGTT, usually done when pregnant. Blood is drawn when fasting, then the pregnant woman drinks liquid containing glucose. The blood is then drawn every 2 to 3 hours. Urine test detects the presence of glucose in the urine. Treatment for type 1 diabetes is insulin injections. Treatment for type 2 diabetes could be insulin injections or medications or a combination of both. 5 dietary recommendations. Limit carbs. Carbs turn into sugars. Do not skip meals. Distribute your foods evenly and have small meals. Avoid alcohol. It can interfere with your medications. limit foods high in sugar, and use less salt in food. In conclusion, it is very important to treat diabetes early before complications occur. If you have family history of diabetes or have been experiencing any of the symptoms mentioned, see your doctor to get tested for diabetes. Diabetes may not go away, but you can help control it and keep blood sugars at a normal level and live a normal life.